It's really a proud moment for DGHS Nursing Division to host such a wonderful international conference on behavioral addiction and substance use disorders, the current nursing practice. It's really a dream come true moment for us to collaborate with various experts nationally as well as internationally. My warm greetings from the Government of India to the eminent dignitaries of the day, Dr. Stuart, Dr. Ambali, Director from LGBRIMH Tejpur, VC D.Y. Patel University, VC Gitanjali University Udaipur, and representatives of Health and Beyond Foundation.
Health and Beyond Foundation is public health and social development organization in India, committed to vision of sustainable solutions for health. Its team of highly experienced health and social development professionals and work across a spectrum of public health programs. So we have a representative, Mr. Francis, from this organization. The video, please. And participants, please listen to a person who has gone through drug addiction personally. And we have taken his interview and see what level he is working. So I want all of you to understand that everybody has the potential to improve and everybody can go to very high heights. We need to have faith in us and all of us to help. All of us have to help people who are having addiction problems. So this is the best example and the role model that you are going to listen now.
Greetings from Health and Beyond Foundation, India. We would like to thank the organizers for the opportunity to share some views from our team member, Mr. Francis Joseph. Francis is a survivor of drug addiction. He is an activist working on health and human rights of people who use drugs in India and across Asia. He came into drug treatment program and has managed to abstain from substance use for almost 2 decades now. Francis is a researcher by training and has carried out numerous studies on health issues among people who use drugs. Presenting Francis Joseph.
Thank you all for giving me this opportunity for sharing my thoughts. While I have been successful in overcoming this, many of my friends and colleagues continue to battle substance abuse. I was fortunate to have got the right kind of treatment and support at the right time. In fact, when I was just hitting rock bottom due to my drug addiction. I was introduced to drugs by my friend when I was in college. Of course, it was purely experimentation for the first time, but the effects and experience was such that made me try all sorts of drugs available to maintain that high that came from using drugs. There was a time when I would start using right from the moment I got up in the morning till the time I slept for the next 15 years. I was scared to quit because I had experienced painful withdrawal symptoms. I was physically weak. I was in a deteriorated mental condition and had no money on me. My family disowned me. I had no place to take shelter. I was involved into petty crimes as well. There came a time when I was completely shattered and had no food, no clothes, no income, no family, no social life, and then I decided to quit. I then went through a painful process of withdrawals and was fortunate to have my peers who supported me during that phase. Today is more than 18 years that I have not looked back, and I am actively working for the welfare of people who use drugs. Of course, medicines do work during treatment, but substance dependence is a compelling psychological disorder and needs a comprehensive approach that should focus on a whole person recovery. Nurses and paramedics have a greater role to play during the treatment phase through one-on-one interactions, focusing on motivational and inspirational counseling. The interactions encourage individuals on taking ownership of their lives for quitting drugs and focusing on managing trigger situations while moving on to a personal, productive, healthy lifestyle and for gainful employment. Thank you so much for hearing me.